Let's get stuck straight in. Sam Groth is the Victorian opposition spokesperson on youth, tourism, sport and major events, and a regular, of course, on Fridays. Sam, good to see you again. I want to start with this whole idea during the week that Victoria, we've had a decade of Labor governments, are so broke that they're overseeing the collapse of regional health care, with Country Health Services warning the government about closures and job losses. I mean, surely, Sam, scrapping expensive projects like the suburban rail loop might be better than closing rural hospitals, wouldn't it?
Well, Steve, great to be back with you again on a Friday, and I wish we weren't having to talk about this, because these cuts that are coming for regional health, and the Minister of Health seems to want to deny that this is going to happen, but I live in a regional community. I've got a regional hospital down here in Rosebud that is in desperate need of further funding. But when you make cuts to regional health, it is actually regional Victorians that suffer, and the government claiming that it wants to make cuts to backroom staff, well, somebody has to end up filling the work that those staff do. It's going to end up being those frontline workers that take over that workload. And in the end, it's going to be the people out in regional Victoria who want to go in and get healthcare when they need it, who need it desperately and urgently at times. This government can't manage money, and now it seems they can't manage the health system.
What are we governing here? We're governing for the inner suburbs of Melbourne, Sam, for the greeny, lefty suburbs of Brunswick and Fitzroy and Carlton and places like that, and not worrying about the regions.
Steve, you've got to remember as well, coming into the 2022 election, this government, Jacinta Allen's government that she now runs, they told us that we didn't have to choose between health and infrastructure, that people could have both the healthcare that they required and the infrastructure and the jobs that come with that, as well as, let's say, the suburban rail loop. Well, it turns out a year and a half later that is complete and utter nonsense, and this budget's not going to be a good one for Victorians. We don't want to see cuts to the health system. We don't want to see those frontline workers who work in the health system put under more pressure than they currently are. But cuts to regional health, amalgamations, closing of wards, it's just not acceptable.
So, Sam, you mentioned Rosebud Hospital. I can reveal tonight that, and that's in your electorate, as you said. I was talking to a friend of mine. His son turned up at Rosebud Hospital at the emergency department at 1:30 yesterday morning. So 1:30 in the morning. Rosebud Emergency Department, young fit bloke. He's a builder by trade. You'd love this guy. He's building houses down in your electorate. He was in excruciating pain, which looks like an ear infection. It's bad enough that he's now been admitted to a private hospital. Sam, he turned up at casualty. He's a local, and he was told, and I've got no reason to doubt this, there would be a 7 to 8 hour wait for him to be attended to.
Yeah, look, can I say, I've been to Rosebud Hospital many times. I've dealt with the staff there. My kids have been in there. The staff do an incredible job, but when you're understaffed, this is exactly what happens. And I'm actually happy to try to go away and look into this and see if I can find some more information, Steve, because anybody having to wait 7 or 8 hours in emergency is just not acceptable. We see a lot of people, my offices here in Rye, we see people from down this end of the peninsula consistently put into ambulances and taken up to Frankston. I mean, nowhere. Talk about a regional health system. Well, we can have that metro-regional debate. The government classes as metropolitan. It is 45 minutes, no traffic, to get up to Frankston Hospital. Nowhere else in metropolitan Melbourne do we have that fight. I'm fighting for Rosebud Hospital and the funding, but we're going to continue to fight for regional health services right across this state.
Look, I've been in there myself, Sam. I had an anaphylactic reaction to a skin cancer getting cut out, and the staff were fantastic. So I'm not having a go at the staff at all. I think it's a perfect example of how the state government has allowed these public hospitals to be run down.
Yeah, absolutely. And that hospital needs a redevelopment. And I agree with you. The staff are fantastic. In no way are either you or I slighting what the staff do there. They're amazing. But that hospital does need a redevelopment. There's a 2-stage plan on the table. The government has the business case. I tabled in Parliament just recently 3,500 signatures from locals about the redevelopment of that hospital. It's something that just needs to happen. But, the chances of that hospital being built under this government, when we're seeing the upcoming budget going to include huge amounts of cuts to the health system, I wouldn't be holding my breath if I was locals, but we will continue to fight for it, just like I said we would for all those health services right across the state.